And good greeting I wish for everyone. So today I'm going to present about my research for the topic of research methodology and scientific communication. So my research topic is the study on the level of the knowledge of hyperlipidemia among the assistant medical officer, staff nurse and healthcare attendant at Sarawak General Hospital. My matrix number is 99051613586001. So I'm in the semester of January in the year of 2025 for the program of Bachelor of Medical Health Science with honors. So the introduction for my research is, according to the World Health Organization, there's a 39% stated for the global adult population is affected by high blood cholesterol, with a notably higher prevalence in women, 40% compared to the men of 37%. So the ischemic heart disease accounted for 12,648 male deaths, which is 17.6%, while pneumonia was the leading cause of death for females, total in 7,815 with 16.4%. 6 states Pahang, Perlis, Pulau Pinang, Sabah, Sarawak, and Wilayah Persekutuan Labuan have identified pneumonia as the primary cause of death. Meanwhile, the other 10 states are reported that ischemic heart disease as the leading cause of death in the state. So the background for my research is healthcare professionals such as medical assistants, staff nurses, and the attendants are vital for patient education and preventive measures for hyperlipidemia. So, these studies aim to assess and compare the understanding of hyperlipidemia among medical assistants, staff nurses, and healthcare attendants to identify knowledge gaps and improve future educational efforts. The standing of hyperlipidemia among non-physician healthcare providers varies, often influenced by training, work experience, and access to clinical updates. Their knowledge significantly impacts care quality, especially in promoting lifestyle changes and medication adherence. So the problem statement for this research: globally, dyslipidemia is responsible for approximately 2.6 million deaths and 29.7 million disability-adjusted life years. So in Malaysia, there are total of 64% of adults with elevated total cholesterol and 56.7% with high low-density lipoprotein cholesterol. Despite their involvement in disease prevention and health promotion, studies show that healthcare workers report higher NCD prevalence than the general population. So the objective of this research for main objectives is to measure the level of knowledge of dyslipidemia among the assistant medical officer, staff nurses, healthcare attendants at Sarawak General Hospital. Meanwhile, for specific objective is to study the relationship between the knowledge of dyslipidemia and the incidence prevention among the assistant medical officer, staff nurse, and healthcare attendants at Sarawak General Hospital to study the relationship between the knowledge of dyslipidemia and the profession of assistant medical officer, staff nurse, and healthcare attendants at SGH. So the hypothesis of this research, there are two. For the first hypothesis, null hypothesis, there is no significant difference between the knowledge of hyperlipidemia and the incidence prevention among the assistant medical officer, staff nurses, and healthcare attendants at SGH. For alternative hypothesis, there is a significant difference in the knowledge about hyperlipidemia and the prevention of incidents among the assistant medical officer, staff nurses, and healthcare attendants in SGH. For the second hypothesis, for null hypothesis, there is no significant difference between the knowledge about hyperlipidemia and the profession of the assistant medical officers, staff nurses, and healthcare attendants in Sarawak General Hospital. Meanwhile, for alternative hypothesis, there is a significant difference between the knowledge about hyperlipidemia and the profession of assistant medical officer, staff nurses, and healthcare attendants in SGH. For literature review, one of my literature review taken, the researcher is Kwan. So the purpose of the research is to evaluate the lifestyle factors associated with cardiovascular related disease risk among healthcare workers in tertiary hospital in Sarawak, Malaysia. So the samples are 499 participants in the tertiary hospital of Sarawak, which are Sarawak General Hospital and Sarawak Healthcare Centre. So the method used is cross-sectional study. Results, more than a quarter, which is 47.4% of healthcare workers were either overweight or obese. The high BMI is an independent contributor to the risk of developing CVD. For methodology, the study design that I use is descriptive, quantitative, cross-sectional study. Population of my research is 1,000 and the setting is at SGH. So the sampling design I use is simple random sampling design. I use Krejci and Morgan. So the population is 1,000. So the sample based on this diagram of Krejci and Morgan 1970 is 278 participants that I should take. That includes. So the research instrument I use the questionnaires distributed in the form of Google Form for the selected participants of sample for my research. So there are 4 parts of these questionnaires: Part A, Part B, Part C, Part D. So Part A is about social demographic data that includes sex, age group, race, educational level, profession, place of working, medical history, and family history related to certain diagnosis stated. So Part B, C, and D total are 15 questions. So the questions should be answered either true or false regarding the risk factor and prevention of hyperlipidemia. So the data analysis, all different parts address to different objective. So these questionnaires, these data will be collected and be analyzed through by using central tendency measure, percentages, and engaging visualization such as pie chart, bar chart, histograms. So the conclusion, this study highlights the varying level of knowledge about hyperlipidemia among healthcare workers, revealing both strengths and gaps in awareness and understanding. Improving healthcare worker knowledge and hyperlipidemia is vital not only for optimizing the self-health status outcome, but also to reduce the overall burden of cardiovascular disease in the population. A well-informed and health-conscious workforce is essential in leading the way toward improved cardiovascular health and overall public well-being. So the Q&A that I choose overall of the question provide a clear justification why you need to do this study, what is the importance of this study and how it can contribute to patient, society or institution. So based on the data of Statistics Malaysia 2024, this data is based on 2023. The number of healthcare workers with NCD are increasing by each of the year. So, healthy healthcare workers are essential to keep healthcare system running. Focusing on their status ensure that they are not burned out, there are adequate staffing during crises, and the support system are in place to retain. Protecting healthcare workers are also safeguard patients, particularly those who are vulnerable in hospital or nursing home. If healthcare workers are unwell, it poses a direct risk to the quality and safety of patient care. So the less healthcare workers involved with these NCDs, the better the outcome of the quality of the healthcare system. So this can contribute to the patient and society as well. Next, the question explain how you perform the sampling technique and what method you give your argument. So the method, so this is about cross-sectional study, quantitative descriptive method that I use, which is simple random sampling. So I use Krejci and Morgan. I refer to Krejci and Morgan 1970 diagram for the sampling method. So based on the population of my research, which is 1000, then the sample for the 1000 is 278. So I only use 278 samples of the 1000 population to participate in my research. Yes. So that's all from me. Thank you.